Researchers at McMaster University and MIT have made a major breakthrough when it comes to the treatment of Crohn's disease and other similar conditions that could be a promising new option for the millions of people around the world impacted by inflammatory bowel diseases. CTV's Scott Hurst joins us now with more. Good morning, Scott. Researchers are unveiling potential new treatment options for people affected by Crohn's disease. What more can you share with us?
Some promising medical news to share. Good morning, Akshay. Researchers at, as you mentioned, McMaster University and MIT, so Canadian and American researchers, have made two scientific breakthroughs at once. They not only discovered a brand new antibiotic that targets inflammatory bowel diseases, but also successfully used a new type of AI to predict exactly how the drug works. So first, let's focus on the diseases. IBD, inflammatory bowel diseases, the most common being Crohn's and colitis. And in Canada, it has one of the highest rates of Crohn's and colitis in the world. So the stakes are incredibly high here. That's what brings us to this first breakthrough, the brand new antibiotic. Most antibiotics used in clinics are broad spectrum drugs, meaning they wipe out good bacteria in addition to those that cause disease. But the new antibiotic discovered at McMaster is a narrow spectrum drug, meaning it attacks only a specific group of disease-causing bugs. According to researchers, the new drug is a really promising treatment candidate that ultimately could help alleviate symptoms and provide a much higher quality of life, Akshay, for so many people suffering in this country and around the world.
The other part of the story, very interesting also, is how AI helped with entire research. Talk to us about that, Scott.
Yeah, lots of discussion about AI these days, so let's talk about how it was able to work in this case. Researchers say the development of the new drug has been fast-tracked thanks to the collaboration of human research and generative AI. Now, drug developers typically spend a significant amount of time and money, often millions of dollars, trying to figure out a new drug's mechanism of action, MOA, or how it kills bacteria. Now, the principal investigator in this case pointed out, instead of years, they made the initial prediction, thanks to AI, in less time than it takes ultimately to get a cup of coffee. So using AI, the group completed a thorough MOA study in just 6 months at the cost of just $60,000. So really just a fraction of what it typically costs. And now, if all goes well, Akshay, the new drug could be ready for human trials within 3 years. So really promising news for the hundreds of thousands of Canadians who deal with and live with Crohn's and colitis and have to deal with the symptoms on a daily basis.
Encouraging news for sure. CTV Scott Hurst in Toronto. Scott, thank you for this.
Thanks, Akshay.